Hello, everybody. Happy Mother's Day to all the moms out there, and thank you for everything that you do. This is Dr. Elsie Coe with Lead Physician Online Leadership Program for physicians by physicians to help them reach areas in their lives, in their career that they haven't before. Today, I'm so happy and grateful to have Dr. John Su with us. Hi, John.
Hi, Dr. Coe. How are you?
Good. Thank you
Happy
for
Mother's
being
Day.
here. Thank you so much. I appreciate that. We're about to go out to eat after this interview, but I wanted to make sure we talk about what you've done. Let me introduce you, John. We're talking about today's iPill dispenser. Now, Dr. Sue is the CEO and founder of iPill Dispenser. What is it? It's related to the opioid crisis. And what he's done for 29 years, he's a practicing anesthesiologist and chronic pain management physician who's been a serial entrepreneur, really, and doing significant things to make an impact on patients. I want to talk to you, John. If you could you tell us a little bit about the iPill dispenser? And this is a leadership platform. So not only are we going to talk about what you've invented here and how is this going to help patients, but you're really thinking about all the stakeholders and where in physician leadership does this apply, and how can physicians like you who have an idea take it to fruition? So let's just start by tell us a little bit about the iPill dispenser. I have a picture here while you talk.
Sure. So the problem I'm trying to solve is uncontrolled access to controlled substances. In the hospital, opioids are triple locked. The same opioids that are sent home with patients are free. They're not secured. So I developed a system where only the patient prescribed can get access to the opioids at only the prescribed dose and time. The way we do that is with a mobile app. The mobile app has two-point authentication. It has a fingerprint, face print, and personal code that is required to access the app. The app then wirelessly connects to a dispenser. The dispenser is unique because it destroys the pills upon tampering and upon expiration of the prescription. So that means that, again, only the person prescribed can get access at only the prescribed dose and time. This way, I can prevent the 1 in 4 opioid overdoses that involve 1 in 4 opioid overdoses now involves children and teens. So it's not just a patient we're protecting the rest of the households from dangerous opioids.
That's amazing. So what if what if you have somebody who can, what if you damage it? Can you get to the pills, and or did you might have mentioned that already, but how can you prevent them from just, finding a way to open it up?
Well, if you try to open up the iPill dispenser, the whole case is is coated in conductive paint. So it creates an electronic discharge, and then it releases a DEA-approved solution to actually destroy the pills. And then we encase the whole case and all the pills in a resin. So the pills are actually destroyed. So there's no real reason to try to open it anymore.
Wow. And is this for, what about the patients who already abuse opioids and are coming to you for more? I mean, as physicians, we get stuck in the middle of this because on one end we want to help our patients who are experiencing pain, and we know they have pain, but on the other hand, we don't want to be the ones who are, perpetuating the crisis. How do you, what do you have to say about that?
Well, what we do is we enter the we enter the prescription into the app through a QR code. So whatever you write for the prescription will be entered into the app. That also means that the patient has some technical leeway. They
Okay.
can actually change the prescription with a breakthrough device, with a breakthrough
Oh.
dose, I'm sorry.
Uh-huh, uh-huh.
So we
Right.
limit the maximum number of pills that a person can take per day and the number of pills they can take at any one time.
Right. Right. And what do you think about people who have opioids from as prescriptions, and then also go out on the streets to get their heroin or get their substance that they want? Do you think that this can exacerbate potentially people going out on the streets to get medicine because they couldn't get it from this box?
Well, what we're doing is we're actually going to addiction treatment centers, and we're using the iPill to dispense Suboxone and methadone. So that means what we're doing is we're giving these patients the exact time and date that they're supposed to take their medications for MAT therapy. That also means we're trying to decrease the cravings for opioids. By decreasing cravings and controlling cravings, we can decrease the 40 to 60% relapse rate of patients going from prescription drugs, taking more prescription drugs than prescribed, or even taking other drugs. Now, the problem with restricting prescription opioids is the latest papers from JAMA are suggesting that if you restrict opioids, you're going to force people to go to illicit opioids. What we're trying to do is give patients their access to prescription opioids so that they don't want to go to illicit opioids. We're satisfying their need as prescribed.
Yep, and you're giving them an organized calendar, so to speak, and about when they're supposed to do it, because we're not so organized in our days.
Right, and in the hospital, they're given by nurses, supervised by pharmacists every 4 hours. I'm trying to extend the safety of the hospital to the home. And I think this is how we can help patients reduce their cravings, to take more drugs than needed, to go to illicit opioids. Because 2/3 of the opioid overdoses now involve illicit drugs.
Right.
And that means that, all these drugs are really illicit opioids. We're doctors, we prescribe prescription opioids.
I mean, I think it's fantastic. I think you're not only touching the patients' lives, but you're helping the providers. You're helping the physicians who have to dispense it and give us peace of mind when we're giving these prescriptions to our patients. And also, you're helping the public. You're helping the government, the politicians, in terms of how are we going to control it. I think that's fantastic. How did you even come up with this idea? Where did you come up with this idea? Sometimes we talk about people meeting together and writing it down on a napkin in a diner. Where did this start?
Well, it comes from my practice. I couldn't tell if my patients were taking the opioids on time, not taking them, selling them, abusing them. So I would spend hours arguing with patients when they come in early. They would threaten me with bad Yelp reviews, going to the administration saying I was a uncaring doctor. And on one particular day, it was a tough day. I argued with several patients about not giving them opioids early. And I went, it was late. I was hungry. I missed lunch. I went to the bank to get money so I could go eat my dinner alone in a fast food restaurant. And it just dawned on me, I used my car fob to drive my car. Why don't we use that as authentication on a mobile app, just like my banking ATM, online banking? And then for the ATM, it requires 2-point authentication, and I can only get a certain amount of money at each time. And there's a limit, maximum limit. Why can't we do this for opioids? So it was really over some fast food, and not, and that's how it came about. And then I started tinkering. I started writing a little bit of code and tinkering in my garage, bought some product on Amazon, and sort of put the first one together. And it was very crude, but then I hired the right people and made it closer to production. We're FDA Class 1, 510K exempt. We can sell the product today. We're going into human factor trials soon. We're moving along.
So are you selling this today, John?
We want to do human factor trials to make sure I know what a patient is going to have a problem with and how a patient likes it, so I can make it a good consumer product so that patients can make this as simple as using a child-resistant cap. Interestingly, child-resistant cap was developed in 1967 by Dr. Henry Brialt in Canada, and it hasn't been changed for 54 years. It was a mandate. It was mandated in 1970, but we haven't changed it. And kids are getting smarter. The child-resistant cat dropped opioid overdoses by 91% right away. And
Wow.
today, 1 in 4 opioid overdoses involves children and teens. 73% of teens get their opioids from their own medicine cabinet.
Wow. And it's from their parents who just leave it there.
Yeah, because most people don't know what do you do with your unused excess. Yeah, what do you do with your extras?
Right. So true. Wow. Awesome. And you know what? Coming from a physician, you understood from the ground up what was going on, what were the problems. This is why I'm such a big advocate for physicians getting leadership training, because we're the ones who are going to be able to solve a lot of these problems. It's a matter of being able to take that idea to fruition. So tell the physicians out there, tell the healthcare workers out there, how do you take an idea? How do you become brave enough? We kind of spoke about, earlier on in your career and earlier on in your life, you weren't so brave. I mean, we always talk about the successes, and when I look at you, I could see such success. It's written all over your face. But you didn't start off that way. There are parts of you that was insecure. Parts of you have imposter syndrome. I think majority of people have it at some point in their life. They just don't talk about it. So can you tell people out there, how do you take your idea? How do you overcome the fear and develop that self-image to become successful in what you're doing?
Oh, wow. This is a tough subject.
Not to put you on the spot, but it's Mother's Day, so I thought I'd ask you a hard question.
Yeah. Again, happy Mother's Day. Well, imposter syndrome is tough.
Yeah.
I'm older, and growing up, I was teased. I was told I was not good enough. I had a tiger mom. Always do better. You're never good enough. And I had to work twice as hard as everyone else because I always felt that I was never good enough. And through my career in college and practice, I had to work twice as hard because I felt like I wasn't good enough. And working twice as hard, I gave up on a lot of different aspects in college. Everyone was having fun. I'm in a room by myself studying.
Wow.
Even in starting out in clinical practice, where we were, there were not very many Asians, and I was always looked upon as not doing the same thing as everyone else. And so I had to work twice as hard and be twice as good. If I made a mistake, I would be roundly criticized. So I had extra pressure to be extra good. And sometimes it worked and sometimes it didn't. It created a lot of stress.
Wow. Oh boy. You took the opposite reaction of some other people who might have say I'm not good enough, and people can spiral down and wallow in their sorrows. But you took it the other way. You took it as a springboard to push you up. How do you work twice as hard when you feel so down?
Well, it's fear of being embarrassed, fear of being told I'm not good enough again. It made me, it honestly got me angry. And to relieve my anger, I did more than everyone else. When I first started in my practice, someone would ask me, "Can you take call for me?" Sure,
Right.
sure. And I was taking call. I was working every day for 9-10 weeks straight.
Wow.
And I wanted to prove to them that I was good enough to be at that hospital.
Wow. What would you say to your younger self now, John, that now that you've known what you've gone through, how you became successful, what you went through before to get there? Would you go back and tell your younger self that that's the way you should do it? Or would you tell yourself something different?
I would tell myself to be very, very careful about messaging, to only not say very much, just to show people through your actions what you can do. One of the problems with imposter syndrome is that you may say things and you may try to make yourself look better than you actually are. I would say don't do that. Don't say anything. If they tell you you're not good enough, say, okay, well, let me try harder. Let me do more. I would try to argue when people would say that you're not good enough.
Right. You mean maintain humility.
Yeah. And maintain humility and show people what you can do. Don't say it, just show it.
Yeah. Our insecurities push us to say things sometimes that we don't really mean, but what we want to accomplish. I know I've been there. I've done that. I was not a good leader when earlier on in my career. I'm still learning about leadership. I actively learn. But back then when I didn't even know what I was doing as a new medical director, and people thought maybe on the surface that I was strong because of the way I was speaking, but inside I wasn't. And it would have been better. And if I spoke to my younger self to say, Elsie, it's okay to say you don't know. It's okay to ask for help. It's okay to that you're not where you should be, and just admit to it, and people will respect you more.
That's great advice. If I was 28 years younger, I would say, thank you very much. I will really take that to heart, and this is the way I'm gonna make my practice and incorporate it into my personality.
Right.
I really should have done that early.
But you did something right, because where you are right now, I mean, you've been on a journey. There are many ups and downs that we could talk about, but we don't have the time. But you learned from these experiences and setbacks and got to where you are today. So I congratulate you, John. Can you tell us how people can find you? And, are there, I didn't even ask you this, but are there modes of investing, and how can people find you?
Well, I'm on a Start Engine crowd platform. One of the most interesting parts, I think I have a solution. Everyone's giving solutions, right? But I've actually looked at the problem from my years of practice, and I'm combining the solution and the problem. Most people just give the solution. So and not a whole lot of people have invested in the company. I'm so surprised. I thought a lot of doctors would like it, but it's been hard, and I completely understand. So I went thinking outside the box. I went on a crowd platform, and that crowd platform is Start Engine. We have you can invest
I
in.
did put that in here. Hold on a second. I did type that in before, so sorry about that. Yes.
Oh, no problem.
Okay.
Go ahead. You can learn more about the iPill at startengine.com/iPill, and you can make an investment there if you would like. This project is really more than me. It's not me. We have a team, and I think this project is for society. The COVID crisis has made things worse. Digital healthcare is all out there, but the problem with digital healthcare is that there's no way to monitor pharmaceutical intervention. Digital healthcare is just like telling patients not to use their drugs, but these patients are holding a bottle of pills. So you haven't solved anything. So that's like asking a wolf to guard the chicken coop. So what I'm doing is I put a steel cage around the chicken coop.
What a great way of putting it. Okay. What about your email, or can I show everyone your email and
yes, please.
The website? Okay.
Sure.
So here's your email, john@ipilldispenser.com. And the website is ipilldispenser.com. Thank you so much, John, for being here. You're very inspiring. Not only have you developed this company, but you have your own drug development company. And just physicians out there, if you have an idea, start from scratch like I did. He bought parts from Amazon and just test it out and take small steps every day. And you're going to be able to be the solution to our healthcare issues. Step up to leadership and learn how to be a great leader. So thank you, John, for being here. I want to invite you to come to my website and sign up, listen to these weekly podcasts that we have on this platform. And if you have a story to share with people, please contact me at info@drlcco.com. I would love to hear from you so that we can share and get better together. Happy Mother's Day, everyone. Thank you, John.
Thank you very much for having me.